Did you know that pancreatic cancer is known to be the fourth leading cause of cancer death in the world and third leading cause of cancer death in the US? In fact, it has been estimated to kill more people than breast, prostate, and colorectal cancer combined. But probably the worst thing about pancreatic cancer is that it's usually very hard to detect and often shows up in advanced stages with very low chances of survival. But the good news is that early detection can increase the chances of survival from this deadly disease by up to 84%. And that's why we have decided to show you some of the warning signs of pancreatic cancer you should never ignore. So without any delay, let's begin. Number 1. Abdominal pain. This sign can be due to many reasons, such as overeating or gas. But it's also one of the most common warning signs of pancreatic cancer. This pain is usually located in the upper abdomen or in the back, and sometimes can be quite excruciating. It can happen when the tumor in the pancreas starts increasing in size and presses against nearby nerves and organs in the abdomen. This may result in constant and intermittent pain that worsens when you eat or lie down. So if that's the case with you, rush to your doctor to get yourself checked. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, then please support us by becoming a patron. Number 2. Unexplained weight loss. Unexplained weight loss is another common symptom of pancreatic cancer. This is because the tumor can affect the body's ability to digest food, leading to a loss of appetite and weight loss. In fact, up to 80% of people with pancreatic cancer experience significant and unexplained weight loss before they are diagnosed. Another concerning fact about pancreatic cancer is that when the tumor grows further, it can potentially block the entry of food from the stomach into the intestines, leading to the symptoms of indigestion, nausea, vomiting, and loss of appetite. If you have noticed a persistent loss of appetite, in addition to other warning signs of pancreatic cancer, it's important to see a doctor for a timely diagnosis and treatment. Number 3. Other digestive issues. The bile duct, which carries bile from the liver to the small intestine, passes through the pancreas before it empties into the small intestine. The pancreatic tumor can become large enough to block the bile juice from entering the small intestines. In the absence of bile juice, our body won't be able to absorb nutrients from food efficiently, especially from fatty foods. Eventually, this can significantly disturb the whole digestive system and can cause diarrhea, irregulated bowel movements, and even malnutrition. So you should never take these symptoms of pancreatic cancer easily and get yourself checked on top priority. Number 4. Yellowing of eyes and skin. One of the most common and prominent signs of pancreatic cancer is jaundice. It is a condition that causes the yellowing of the skin, especially the eyes. When the tumor in the pancreas grows bigger, it can potentially block the bile duct. So the bile juice or bilirubin starts building up in the liver instead of going into the intestine. As the number of bilirubin increases in the liver, it also starts increasing in the blood and shows up in the form of light yellow or pale yellow color of eyes. So you should never ignore this sign of pancreatic cancer. As it gets worse further, it can show up in other symptoms of jaundice, such as dark urine, pale stools, and itching in the skin. Number 5. Abnormal changes in the stool. One of the most common changes in poop associated with pancreatic cancer is the development of pale or greasy stools. This occurs when there is a decreased flow of bile into the small intestine, leading to poor digestion and absorption of fats. As a result, the stools may appear greasy, oily, or pale in color. Pancreatic cancer can also cause diarrhea or loose stools, which can be a result of decreased absorption of nutrients in the small intestine. In some cases, pancreatic cancer can also cause constipation. This may occur if the tumor is located in the tail of the pancreas, which can compress the colon and lead to difficulty passing stools. So if you notice all or any of such changes in your stool, it's important to see a doctor to determine the possibility of having pancreatic cancer or other health issues. Number 6. New-onset diabetes. Did you know that 1 out of every 4 patients with pancreatic cancer was first diagnosed with diabetes? Although not all cases of new-onset diabetes are caused by pancreatic cancer, newer research suggests that there is a strong link between the two conditions. More amazingly, around 80% of pancreatic cancer patients were found to have either new-onset diabetes or they had impaired glucose tolerance, which means that their body was not able to regulate blood sugar levels efficiently. This risk is higher in old-age people, especially those who are over 50 years old. The most common symptoms of diabetes are frequent thirst, frequent urination, and sudden and severe feelings of hunger. So if you notice all of these symptoms, do not ignore them, as they could be a sign of a serious underlying disease, such as type 2 diabetes or pancreatic cancer. Now let's see what are some of the most common risk factors of pancreatic cancer. Number 1. Smoking. Smoking is a well-known risk factor for pancreatic cancer. According to the National Cancer Institute, smokers are 2 to 3 times more likely to develop pancreatic cancer than non-smokers. In fact, experts have observed that around 21% of patients with pancreatic cancers were smokers. For them, the risk of developing cancer increases with the duration and intensity of smoking. Number 2. Obesity. Obesity is also one of the major risk factors for pancreatic cancer. A study published in the Journal of the National Cancer Institute found that people with a BMI of 30 or higher had about 20% higher risk of developing pancreatic cancer than those with a BMI of less than 23. Number 3. Chronic pancreatitis. Chronic inflammation of the pancreas, a condition known as chronic pancreatitis, is also a risk factor for pancreatic cancer. According to the studies, people with chronic pancreatitis may have up to 3 times higher risk of developing pancreatic cancer than healthier people. Number 4. Unhealthy diet. People who eat an unhealthy diet quite often, particularly a diet high in unhealthy saturated fats and processed meats, were found to have up to 68% higher risk of developing pancreatic cancer. Experts also observed that many pancreatic cancer patients had lower levels of lycopene and selenium. And this could mean that people who eat lycopene and selenium-rich foods on a regular basis may have a very low risk of developing many types of cancer, including pancreatic cancer. This is probably because lycopene is a powerful antioxidant and also has anti-cancer properties. Impressive, right? Cooked tomatoes and tomato ketchup are among the richest sources of lycopene and beta-carotenoids. Other lycopene-rich foods include watermelon, pink grapefruit, papaya, and pink guava. As for selenium, some studies suggest that people who had higher levels of selenium in their blood had a lower risk of developing pancreatic cancer. Although the exact mechanism by which selenium reduces this risk is not so clear. However, having this mineral on a regular basis can definitely have a positive effect on your overall health. Seafood, organ meats, and Brazil nuts are among the richest sources of selenium, antioxidants, and omega-3 fatty acids, all of which offer amazing health benefits, including a lower risk of developing cancers. Thank you for watching and subscribing to the channel. See you in the next video.